Okay, by my clock it's 2, so I think we'll get started. My name is Angela Heinzman. I've probably seen a few of you before, and today I'm joined by Majeen from Edmonton Southside PCN, who's moderating today's webinar. So we'll get started with a couple of intro slides. Most of you should be on mute unless you want to come off mute, and we absolutely are encouraging everybody to have a conversation with us today. So please, please feel free to come off mute when you have something to contribute. And also, if you want to come on to the video, we would welcome you to do that because it makes us feel less alone, like floating heads on the screen. So, today we are recording this meeting, and that should have been, you should have been warned of that as you joined. So that's great. We also want to recognize that we're webcasting from and to many different parts of Alberta today. And as you probably know, the province of Alberta is located on Treaty 6, 7, and 8 territory and is a traditional meeting ground and home to many Indigenous people. We are recording the webinar, as I've said, for quality and training purposes. We're going to post a recording of the webinar or the meeting today on the ACT Collaborate site, just for the purposes of sharing and learning, but it's really only available to those people who have a secure login to this site. So it's not available to the, intranet at large. So hopefully that makes you feel a bit better. And we also wanted to just remind everyone about the Provincial Practice Facilitator Network. We do have a vision, which is to support every PF to facilitate implementation of the patient's medical home. Our mission is to build a culture of continuous quality improvement, and our values are listed there. So evidence-based collaboration, connections, safe patient care, joy in work. So we're going to get you guys to do a little bit of work now. So if you have used the Zoom annotate feature before, please use the annotate feature to tell us where you're calling in from today, just so we can get a view of the geographical spread. If you've never used it before, if you go up to your I think it's more options on the Zoom, there should be a section there for annotate, and then if you click on the stamp, you can, choose your stamp of choice. So you can do heart or star or an arrow or whatever floats your boat. So looks like we have a few. Now I'm wondering if that is Edmonton people, because I always find that this map is, I have to figure out where I actually live on the map without the city names and stuff. But looks like we've got a good range. You're the center.
We have a few that's outside of Alberta.
Yeah, it's kind of cool if you really are outside of Alberta. That's great. Yeah, I think we did have a map before that had cities on it, or even I think it was like the regions or the zones. But we just gotta use our best guess today. So. That's great. It looks like we got a lot of people from different parts of the city or parts of the province, sorry. Okay, so let's move on. So I think the next slide is about the practice facilitator competencies.
Perfect.
Oh, and I need to clear all your drawings. One moment. There we go.
Perfect. Thanks, Angel. So we just wanted to remind everyone about the practice facilitator competencies, but we also wanted to just show how just the practice facilitator competencies, how that relates to what we are going to be speaking about today. And so for those of you who may not be familiar with the practice facilitator competencies, there's more information on the ACT website, but there are 4 major components, and that involves the context of primary care, patient's medical home in the health neighborhood, quality improvement, and modes of influence. And these different categories essentially talks about the different fields where it it builds on a lot of the work that we do as practice facilitators. If you could go on the next slide. So modes of influence involves engagement, change management, project management, facilitation, training, coaching, team dynamics, and functioning. Go on the next one. And so today we're going to be talking about engagement as well as quality improvement. And so these two fields are the main components of the competencies that we're going to be talking about throughout this webinar. Go on the next slide, please. And so we're going to talk about engaging physicians, talking about an elevator pitch. As practice facilitators, we have the role of being a change agent. And so today is really about a conversation because we know that 2020 has brought on a lot of changes, a lot of things that we're still navigating both personally and also as practice facilitators. And so we know that many of you guys have had great successes in engaging physicians and clinic teams. And so today is a bit of a roundtable of what these successes have been, as well as challenges, and what are those shared learnings that we could learn from each other on what's worked and what we can implement in our clinics. And so it's really going to be talking about engaging. So so the question is, the first question that we want to ask everyone is, how have you been engaging physicians? So what are some ways that you've been able to get the attention of your physicians? And feel free to use the annotate feature to type in your answers, because we definitely would love to hear on what are those main highlights of how you've been able to engage in your clinics.
And I just realized that our instructions here don't show you, when you go into annotate, there's also like a text. It looks like a T. And if you click on the T, it means it gives you a box and you can start typing. So you can write as much as you want and then it'll show up on the screen.
See webinars, lots of webinars.
Yeah, and virtual care was a good in. I like that one. Yeah.
Being persistent. It's good. It also makes me curious on what does that mean by being persistent. CIC part e-notifications, having a clear game plan, webinars in regards to paneling, in-person conversations, creating a good relationship with the physicians, lots of CISC bar, which is great to see.
Yeah, absolutely. So share data and have one area to focus on. Don't expect them to do the background work themselves. Acknowledging time is limited. Yeah, for sure. What's important to them and what they want to work on, perhaps, or find out.
Yeah.
Creating a concise PowerPoint, I think that one says. Meet them where they're at. Understanding change fatigue is real. Yeah, for sure.
Yes.
I feel that.
Yeah, we're going to talk a little bit more about that too. Put that down. These are great answers. And it seems like there's also a lot of common themes across the board, one being CI, CPAR, and e-notifications. especially because of everything that's going on, which is great.
Does anyone have anything they want to share verbally if you wanted to come off mute?
Yes, love to hear from you.
Still some good ones coming in here though, setting goals, finding solutions for their needs.
Alice or PCN here.
Hi there.
So we're having a little trouble typing in and seeing where it's going to, so I thought we'd just join you verbally. And it's meeting the physician where they're at, trying to find a quick win, and also being quick and to the point, as well as after that follow up on any promises that you've made.
Yeah, absolutely. Yeah, those are good suggestions. Palace, are you guys, have you been back in the office for a while now?
Yeah, we have come in and we are, of course, doing physical distancing right now within our central office since probably June.
Okay, yeah. Do you think that's been, sorry.
Most of our clinics are, like back in July, started doing face-to-face visits in combination with our virtual visits too.
Oh, great. And have you been able to meet with physicians at all, like face-to-face, or are you still doing that human stuff?
Yeah, we are doing face-to-face. A couple of physicians want to do virtual, but quite a few of them are meeting face-to-face, and depending on the space we can meet in, sometimes we have to take, masks and things, but
sure.
We are getting moving with the regular work we have to do.
Good stuff. That's good to hear.
Great, yeah. Yeah, I like this. There's a comment that said acknowledging that time is limited, and I like the visual of the elevator pitch, the elevator image that we shared earlier, just because it does show that that limit of time that we often have with physicians. I think it was the same before. Well, we had limited time before COVID. And with everything that is happening right now, it's also the change is a little bit different, but the restrictions look a little bit different, but time limit remains still a challenge or a factor.
Yeah, absolutely. Yeah, like there's a couple in here that are interesting. Main office efficiencies at the PCN and team effectiveness. Okay, well let's move on to the next question. Oops.
Okay. Look at the next slide. I'm gonna clear that. And so, what are some current challenges that people are encountering in engaging clinics and physicians? I know we talked a little bit in the last slide about just the time limitations that some clinics or some clinic teams are experiencing in engaging the staff in any QI related work or in any initiatives that relates to the patient's medical home. But what are some other challenges have you guys been encountering? Oh, you can go on the next slide. I think there's and so we wanted to share this image to prompt a little bit of just thinking about the health ecosystem. There's so many different elements that comes to the health ecosystem that we have on the outskirts of it all. We have the healthy community, so that's made up of schools, recreation, food, spiritual, environment, finance, housing. And when we look a little bit closer, is the health neighborhood, and that involves public health, community health, supportive living, long-term care, primary care, of course, but we also have home care, rehab services, labs, and health promotion. So we wanted to share this slide as one way of having those conversations on when we're looking at those different levels of the health ecosystem and the patient's medical home being at the center of it all. What are those challenges that are preventing physicians from being engaged? It may touch on any of those communities. So feel free to type it in. I know that I think a few of you have the stamp button, but feel free to type in those answers, or you can also come up mute to share those, or on the chat box.
So it's Sandy here. I don't know if this is the same kind of challenge, but I found it to be a little bit hard because the physicians are in the clinic and their staff are in the clinic, and yet the PCN staff has been working more virtually. So I found that there's a little bit of a disconnect with the physicians because of that. So, and I don't know if that's just on our part from the PCN. The physicians are feeling that way as well, that, you know, hey, we're here for everybody else. So that's just one of my my challenges right now.
And Anita in the chat, she's saying physicians using virtual care from home has been a challenge for them. Information overload from Christine.
Yeah, for sure.
It's a good one. And then on the screen, social disadvantages for patients. Hard for physicians to navigate. Technology is not all being equal. So virtual medicine and EMRs, yeah, that's for sure.
That's true. Yeah.
Some change fatigue. Oh, leaving and retiring, or retiring due to the government. Physician frustrations with government, public health, COVID-19, Zoom, busy with patients.
Yeah, looking at also even just, I'm just thinking about the changes over time in the past couple of months, how the information keeps changing and evolving, and that making it difficult for any decisions to be made because of the fluctuation of it all. Changing political landscape, yeah.
Definitely. A sense of complacency when not meeting with physicians in a face-to-face setting. Clinics super busy and focused on COVID, so trying to do as much to ease their load, for example, registration process. Yeah.
Are you guys feeling any paralysis when it comes to not knowing what to do, or are you guys finding also that maybe clinics are feeling that way, where they don't really know what to do? I'm just curious.
Yeah, that's a good one. It's hard to be in clinic with the physical distancing restrictions. Yeah, for sure. I know some clinics are always felt like small spaces before, but even more so if you're trying to have a meeting in a tiny lunchroom or something like that. So.
Yeah.
Oh, there's a good one. Nice long one here. Cracks in the system due to COVID, less pharmacy hours. Patients rejected, long wait times, pushing more patients to ER. Yeah. Puts pressure on the system overall. Lack of connection between community partners. Yeah.
Yeah.
Definitely.
And I see one that says the ACT site is so rich, but often overwhelming to managers. Interesting.
Yeah, I think there's some there's some work going on to try to make it a little more simple and stuff. And Majeen, you've got a great quote that you've pulled out here from IHI.
Yeah. So I'm glad that everybody chimed in about all the different challenges. I think we're all also feeling our own set of challenges as you know, as one that's also navigating this. And so just wanted to share this quote that we found from the IHI website that talks on empathy in light of all the different changes that are happening globally. And it says, empathy helps connect one person to emotions that another person is feeling. The absence of empathy due to burnout can lead to lower staff engagement. We must express empathy for what our frontline healthcare workers have been going through during COVID-19 crisis as we utilize QI and patient safety assessment on how to do better in future surges. And without offering empathy and emotional psychological support, healthcare systems risk eroding trust, destroying psychological safety, and alienating the doctors, nurses, and other frontline healthcare workers who risk and sacrifice so much to save lives. Reflecting on all the challenges that everybody just posted and we're still talking about, and on the theme on engaging physicians, it's always important to remember that behind every worker is a human being, and we are also experiencing many of those challenges or even personal challenges ourselves, and coming from that place of understanding and compassion can often give us more of that that bridge towards those that we're trying to support and to help and strengthen the patient's medical home as it stands right now in each of our clinics. Sandy says, seeing more frustration around government issues than COVID for us. Yeah. And so it's always important to approach all the engagement that we do with our clinic and from the lens of empathy. We'll go on the next slide.
For sure.
And so speaking of engagement, we want to know have there been some tools that you've been using that you found beneficial in engaging with physicians? I know we've talked a little bit about virtual care is, of course, an obvious one, but we want to hear if there's any other tools that you guys been using that you found beneficial throughout this time.
So mainly Microsoft Teams, stats for informed decisions, Teams, Zoom, of course, providing food. Yeah, that's always a good one.
Okay.
Creating a one-pager. Okay, that's interesting. The person who put creating a one-pager, do you have any more details on that? Like just on QI generally, or a specific topic?
Yeah, feel free to go on yeah, you don't have to be on mute, you could speak.
Yeah, it's Anne from Bow Valley, and I did the one pager. And I also, for those who wanted a little more data background, I attached the latest August 18th data sheet. But it was more from a perspective of a summary, like 3 or 4 bullets summarizing what the initiative is. And then I put a chart of what's in it for me and why do patients care, just from a physician background. And then am I eligible and how do I participate and what kind of support? Because they're so pressed for time, it's just a one-page bullet, and it seems to be going over quite well.
And what was the topic specifically, Anne?
It was just for CII CPAR, just for that initiative.
Yeah, neat. Yeah.
Excellent. And it looks like someone on the screen says they did a one-page introduction of the improvement team and sent that out. Zoom, Teams, and keeping in touch. What's Microsoft Forms? Does anyone want to tell us about that? I've also got an impact versus effort flowchart. I like that idea. Created a PowerPoint with just the initial need to know information, not to overwhelm the staff and doctors. Yeah, for sure.
Or is someone, I'm just wondering if the person that wrote Microsoft Forms, if they are going to share a little bit.
Oh, it says, I think it's used it for a clinic survey. That's cool. Thanks, Purdy.
Oh, okay.
Oh, and Brianna, she says she's having some issues with her mic, but she just started using Microsoft Forms and she loves it. So that's good to hear. Anita, you did a one-pager as well on CIC part. That's awesome. Good stuff, you guys.
Yeah, I'm just thinking about the discussion board being a great way to share those tangible examples. And so definitely feel free to share those examples on there so that maybe other PCNs or other teams might be able to find some benefit and possibly use that in their clinics. That's a great way to share those resources with each other. Because really the aim today is to share those resources and what's helped in everybody else's side so that we could work together, because at the end of the day we're trying to aim for the same goal. PCN Palliser PCN says QI toolkit from IHI.
Awesome. Yeah, and Sandy was just saying, could we post some one-pagers on the discussion board and maybe the effort impact matrix? That would be great, because then we can steal good ideas from each other.
Yeah.
And Anita was saying too, so Brianna mentioned that she uses forms for clinic surveys, intake information, COVID clearance, and could use for TNA collection as well. So Anita from Westview was saying she'd like to hear more about the TNA collection. So if you guys wanted to talk about that on the discussion board, that'd be great. And then everybody can find out more about how you're doing that.
Yes.
Okay, so next, I think we have a video.
People need help
to know where to find good care.
So we evaluate health plan
And medical practice quality.
We create
standards
and highlight organizations that do well.
All this helps drive improvement.
Save lives, keep people healthy, and save money.
People need help
To know where to find good care.
So we evaluate health plan
And medical practice quality.
We create standards
and highlight organizations that do well.
All this helps drive improvement.
Save lives, keep people healthy, and save money.
So that was one type of elevator pitch. Obviously, it's not necessarily the elevator speech you might use for a physician, but we just thought we'd use a kind of a fun example. Majine, I don't know whether you
Yes. So
want
we
to talk about this.
I think we have Brittany on the line that was just going to share a little bit of this particular elevator pitch that we've been able to use at the Edmonton Southside PCN that has brought a lot of great success. Brittany, feel free to.
Yeah, hi everyone. This is from our opioid response coordinator, Melanie. She's a behavioral health consultant and that did a lot of really good work on this opioid initiative last year. And when we met with clinics about this, there was a lot of defensiveness with some doctors, and so she did a really good job addressing everything right off the bat. She just said, I know you really care about your patients and their well-being. There has been a lot of talk about the opioid crisis, including the role of prescriber, patient needs, and the college's guidance. I often hear from doctors that they feel as though they're under a microscope when it comes to prescribing opiates or OAT. We also know that continuity of care is vital for patients and provides better outcomes. So I would like to open up a discussion about how we can support you in managing your patients with complex needs in this area by using the resources and multidisciplinary team that's available to you. And sitting in one of her clinics while she did this, it seemed to calm the suspiciousness and questions about why she was there right off the bat, and let them know that she was there to support them and just there to help.
That's great. Thanks for sharing. The other element when we're thinking about just I love how this particular pitch also talks about, it comes from like that empathetic standpoint, knowing that, you know, every physician cares about their patient, and starting off from that place, and then bringing in, you know, the fact that there's been a lot of talk about opioids. And so sometimes it's really hard to remember these things as we engage with physicians. But as we share those tools, the hope is that the more resources we have available on hand, the easier those conversations will be with our clinics. We'll go to the next slide. So this is another example from the Duke Beaumont Devon PCN. Sandy, feel free to chime in on how you've been able to do that.
Yeah, sure, I will. You know, ideally, it would be so lovely to be able to go in with the great presentation that the AMA's put out. 52 slides, 45 minutes. I don't know about you guys, but I never have 45 minutes, and quite often there's no projector, and so I kind of got it down to about 17 slides that I can do in 10 minutes so that I could go in, and that's been really appreciated. So when I first started reaching out with this 45 minutes, I was met with a lot of resistance, and so I went down to, like I say, a 10-minute presentation and got lots of smiles from that. The other thing that's coming out in the next while, and Angie chime in on this, is some stories from physicians about how they've used it. And so I might even take out more of the technical slides and put in more stories from physicians, so I could still keep it to 10 minutes, but make it that much more relatable to physicians. Like I say, the one that's on the website, the ACT website, it's very technical and it's very good. A lot of our physicians don't really care about that. They just want to know what's in it for them, how's it going to benefit their patients, and what do they have to do, and is there any added work for them. So it's really had taken it down, focus mostly on continuity, and take out lots of the, you know, focus more on it being an enabler of continuity and less on technically how it happens. And we'll just sort that out in the background.
Mm-hmm.
This is great. May I just add, this is Sue Peters from the ACT team. You know, it's interesting, and I totally love your approach because I do the same thing, Sandy. One of the slides that I think the physicians really seem to like is the one that shows the overall system with how Connect Care interacts with NetCare. Because it's really confusing. And when you talk with someone from AHS, Connect Care is the be-all, end-all, it's going to save everybody's life. But it's not. It's part of the system, and the actual record is NetCare. And so trying to understand how all those pieces work together, like I'm constantly showing that slide, and then it's like, can I take a picture of that? Because that's really helpful. So it's just a tip. That's one you might want to look at.
Great. Thanks for sharing.
Great.
Sorry, I was just looking through the chat there.
Yeah, I was wondering also if anybody has any questions for Sandy as we have those slides. So as a little bit of.
Do you know, the one thing I have been neglectful of this as well, so just a reminder to everybody, if we can share these on the, I hear lots of us that have made this condensed version, and I think, gee, if we could do it once and share it with each other, it would have maybe saved us a whole pile of work. So, and like I say, I'm neglectful of doing that as well. So share freely, and if there's something that you want to reach out on the network and say, hey, has anybody developed such and such, so we're not all doing this work and sharing.
Yes,
absolutely. And Rosie's got a good point here too. She shortened it. It's much better, and she's divided it by themes depending on what phase the clinic is at and what's the purpose of the meeting. Like, for example, if it's to discuss completing this COP training, etc. So yeah, so those are all great ideas. And yeah, I think that I was going to put in some of those physician story slides just as examples, and I forgot. But thanks for reminding me, Sandy. And what I'll do is I will put a link to the PowerPoints that have those physician stories in them, because sometimes those are quite useful for like that initial engagement piece, and also to just kind of show like what some of the other peers have experienced going through the process of onboarding with CII-CPAR. So
yeah, when we think about the challenge of engaging, I think having stories and testimonials are another examples of tools that we can use to engage physicians, especially when, with all of the Zoom meetings and everything else, everybody's tired. But it's a little bit easier to hear a story. It's a more digestible oftentimes than just hearing stats and things like that. And so they are beneficial, but having that tied to a human story is always stronger, and it always draws more people in. So it's great.
Absolutely. Okay, so let's go to success stories. Does anyone have any success stories that you wanted to share? Anything that's happened recently or even in the past that you want to share with everybody, just to kind of finish up on a positive high note? And then we've got a few announcements after that. But and you can either come off mute and chat with us, or chat in the chat box, or you can also annotate on the screen if you like. So multifaceted sharing today.
Hi, it's Brittany again. I just had a recent success about CII-CPAR, and it was actually the suggestion of our panel manager at our clinic. Suggested that when I bring it up to this team that we mention an incident that happened recently where a doctor found out 2 months after one of his patients passed away that the hospital had never contacted him. And she said he was really upset by that. So she encouraged me to bring it up at the meeting, and it was a really good entrance because I got the doctors right away talking about what a problem that was. The others talked about other situations where that had happened and how it was a bad continuity of care. And then I was able to talk about a solution right away. So it was a good, quick way to get them passionate about this topic.
Yeah, that's great. I think it's interesting that like sometimes we want to remain positive, but oftentimes those frustration points that physicians have, when we're able to tap into that to actually show how what we do can support and help them, can often be the best entry point for us to actually get so much of that work in our clinic. So this is a great example. Thanks for sharing, Brittany. And even just talking about like the different challenges, I know we talked about it a little bit briefly earlier, and everybody chimed in, but if anybody also has stories about the challenges that they've been experiencing, and if they have a success story coming out of those challenges, it's always great to hear those stories.
Yeah, absolutely.
Hi, Brianna from Leduc here. I'm just, we had a physician work with us to do a webinar on technology within their medical home. And we find that to be really successful to let the physicians know it was readily available for them within their different EMR vendors, but also to see how one of their colleagues uses these technologies in their day-to-day prior to COVID, before everything was rushed on their lap. So that was really successful for us.
Yeah, absolutely.
Megan here from the Red Deer PCN. We were having quite a bit of trouble getting things started with our clinics and CII-CPAR, but recently we were able to onboard another clinic, and it was really helpful because I had gone through it before, so I was able to help out another support nurse, or PF as you would call it,
to onboard that doctor. So now we have another clinic progressing. So that's nice.
I like Lori's comment in the chat. Post-traumatic growth is the expression. Times are tough, but people are doing cool and innovative things. You know, don't waste a crisis, I think we also say sometimes. Thanks, Megan. That was a great example too. And then Rosie has asked me a question. Does anyone have an example of a strategy that has worked to engage physicians? Presentations are great for face-to-face or virtual meetings, but how to get most of them interested in CIIC part, like mass communications, for example? That's a good question. I know we're trying a strategy in one of the zones where we're getting the physician leads in the area to basically, you know, say that they will sign up. So almost getting them to like sign a pledge, they're going to sign up for CIIC part, because if they then go out to their clinics and to their PCN and stuff to, you know, talk about CIIC part, you know, they're taking their own medicine, if you will. So it's hard to tell people to join up if you're not doing it yourself. So getting the physicians engaged in that, I think, has been useful. Although we're right at the start of that strategy, right? So we can't tell you how well it's worked so far, but and then Sue is saying, yeah, presenting at AGMs for sure, engaging a physician champion and having them speak to it.
So
yeah, and
we just had, oh, sorry.
Oh, no, go ahead.
Sorry, we just had a setback, CIAC PAR related here in St. Albert Sturgeon, which was a little unfortunate, where a physician was noted that a patient had been discharged from a hospital, and then it turned out that the patient had actually passed away. So that when the physician called the family to say like, oh, I saw so-and-so was discharged, they had actually died. And I know that that's being looked into, but that's a pretty negative event that, you know, creates a lot of, in a smallish town, creates a lot of people who are gun shy about it until we start to hear, which is fine. We understand that it's unfortunate. But I will say we did have a pretty positive experience where, you know, just those little things where you get to demonstrate your value. Sorry, and it's Neil here from St. Albert Sturgeon, PCN. Hey, we had a clinic that I work with that had identified that they were going to change EMRs, and they had been unhappy with the EMR they were with, and so on. And so I was just meeting with them to talk about, you know, some of their medical home enhancement planning. And as an aside, I said, well, how are you guys doing with changing your EMR? And they said, oh, well, we think it's like this EMR or this EMR. These are the two we're really looking at. And in that moment, I was able to say, well, here's the slight problem. Neither of those EMRs are going to be supported for CIIC PAR. And if you don't do CIIC PAR, we have a number of clinics that are looking at alternative relation ARPs and blended caps. So we were saying like, and so the knock-on effect of that is if you do make that decision down the road, you're not going to be able, you're going to have challenges, right? So, you know, there's going to be all these effects of, which, you know, they looked at as a really great sort of in the moment information that as a practice facilitator, I was able to provide them because of this type of training and these types of meetings, and them just not always having that, their eye on that big picture. Mm-hmm. So sort of being able to tie that stuff together. So mm-hmm. Anyway, that was just my positive event. I know, I think we've maybe kind of moved on from that, but I wanted to share that. Sorry.
That's great. No, thank you for sharing. That's great. I was just gonna say, to answer your question, Rosie, at least for with the Edmonton Southside PCN, something that we recently did was in the newsletters that we send out to physicians, we asked them if they would like to. I think the exact question was if they'd like to learn more about e-notifications on their EMR, to click on this on a button. And so when they did, it prompted us to have that conversation about CIIC PAR, and this has led us to actually have like a more detailed presentation to those physicians who did respond and wanted to learn more about e-notifications.
That's really great. I like that. Yeah. Yeah, because then you're not just talking to them about it because you want to talk about it, right? So.
Yeah, and I think because everybody's capacity varies, and that's the challenge right now. And so I think finding what motivates the physicians are really what helps with the engagement part.
Yeah, absolutely. And then Nancy and Sandy both mentioned talking about it with clinic managers, or I know that at Leduc on Mount Devon, Sandy, you do clinic manager meetings as well, right? So have you been able to talk about CICPAR there?
Yeah, and I think that's in some of our clinics that's been a key to get them going, is talking to those managers. They definitely are the gatekeepers, and so yeah, and we talk about newsletters all the time too. We have a little section, and I've been trying to get quotes from physicians that have gone live to, you know, if there's a benefit or whatever, to make sure that we're including that in the newsletter, so they're seeing it from their colleagues.
And I know Anita from Westview PCN's on the, she's put some stuff in the chat. I don't know if you are able to come off mute or anything, but at Westview in the spring, they had a celebration of improvement where different clinics, all the clinics got together and different clinics presented their improvement projects. And a couple of those, oh, are you there, Anita?
Yeah, I'm here. Hi. Can you hear me?
Sorry. Yeah, I was just going to say, because you had a couple of clinics there, didn't you, that talked about their experience with onboarding CI and CPAR?
Yeah, we had one clinic in particular that we helped him develop a presentation, so he did a whole presentation to the other clinics. So just to get the word out there about what it was about, that was helpful for sure. We're still waiting to go live with 2 of our clinics, and there's other ones that have indicated that they're interested because they've been hearing so much about it. So it definitely has been a helpful thing that they did there.
Awesome.
Yeah.
And Christine in the chat, she said she's been working with a new clinic that's recently come on board at Kalina Country PCN, and she's had the opportunity to work in the clinic with the physician. That provides her with a lot of opportunity to discuss CI, CPAR, and physician QI screening maneuvers. It's great.
That's great.
Okay, well, I think we've got just a few minutes left, so I think we've got a couple of announcements we wanted to pass on before we finish up. We wanted to let you know that we've got virtual practice facilitator training both in the fall and the winter. So we trialed a way of delivering practice facilitator training this summer over Zoom, and we're going to do that again in the fall and winter, just, you know, for now. And so that starts on Monday, September 28th. So basically it's 7 online modules that you do self-directed, and then interactive virtual sessions with the team at ACT. And they're usually about an hour and a half long in the afternoon. So it does sound like a lot of time, but it is roughly the same amount of content that we would have done in a 3 full day session. So so the first session starts Monday, September 28th, and then the winter session will be Monday, January 18th through to March 15th. So if you have anybody that needs practice facilitator training, please join up. And we've got the website at the bottom. It's on the ACT website, and then in the events and training section. And then there's a practice facilitator section to register. We also wanted to let you know that we're relaunching the Physician Champion Network. It starts on September 16th, so that's in a couple of days, 7:30 in the morning for an hour. And the sessions are around, I think there's around 6 sessions, is that right? Once a month, I think it is. Anyway, that's a time for physicians to learn, but also to connect with each other and share ideas and things like that. So there's 2 session types, patients' medical home experiences and leadership skills development. So if you have physicians that you think might be interested, the website's there on the page, but it's also under the Networks of Practice Physician Champions section. And Neil, you have a question? Yes, please.
So we had reached out to Sheena about this because we do have physician leads in all our clinics that are identified, and we fund them for this type of thing. So we've been hoping that a lot of them are going to do it, and I think that there has been some interest. We understand that, of course, it's for physicians, but we were just wondering whether there is some way we can get what information is being passed along so that we can work with it better as facilitators. So whether that's outlines or notes or slides, or just even whether the person running the sessions might be willing to meet with practice facilitators who are interested for a shorter period of time to just kind of discuss, like, you know, this week, this was what we focused on, or things like that. So just put that in your mind that, you know, it would be great if we knew what was being passed along so we could work within it rather than hopefully, you know, not bump up against it.
For sure. Yeah, I will get back to you and see what we can do along those lines. That's a really good question. Okay, any questions about either of those training opportunities? Brianna said that the Primary Care Explained module is a really good overview for PCN and clinic staff too. So yeah, thanks for that. I think it is as well. So if anyone either wants a refresher or has people you want to like orient towards primary care, that module is on the under the events and training section of the website as well. So, oh, sorry. Is someone gonna say something? No. That's true. It probably would be nice for practice facilitators to know who from their PCN is enrolled on the physician champion network. And I can get back to you on that on the discussion board. And yeah, just before we finish up, we wanted to just let you know about the next meeting, which would be Monday, October 5th. We're going to talk about the privacy impact assessment. So hopefully, as people are getting a bit more familiar with the CPAR readiness and tools that you need to have on hand to get onboarded for clinics, hopefully you'll have some experiences to share, or just learn some new information about privacy impact assessments.
Yes.
Dog is not very helpful today. And finally, we wanted to remind you about the Collaborate website. So if you go into the act.albertadoctors.org website, there's a section called Networks of Practice, and you can register for the discussion board if you're not already on there. And that's where you can communicate and collaborate with other practice facilitators and share resources like we mentioned today. So all those great ideas you guys have and cool one-pagers and whatnot. We would love to see those there.
Yes, so. and even success stories. We'd love to hear from. I know this is a brief time to talk about those stories, but if you do think of another success story, we'd be happy to read it in the discussion board as well, because we're always wanting to learn from each other. So this is it's a good space to have that conversation, to continue that conversation.
Absolutely. And I think that is everything for today. So thank you so much for listening and for participating. And thanks so much to Mijing for moderating today.
Thank you, Angel. Thank you, everybody.
Thanks so much.
Bye, everyone.
Bye. Take care, everyone.